I would like to welcome I would like to welcome Mr. Gautam Badra from ABT Corporation to this session.
Thank you very much. It is a good session. I'm learning. Learning is a process, but still I'm really telling you, I have joined in 1981, but today this session is, I learned a lot from Dr. Datta. I'm grateful to Dr. Datta and you, young veterinarian who have organized this program. Thank you, sir. Thank you.
So my screen is visible to everyone?
Yes, sir.
Yes, sir, you can proceed.
Now, most important disease in poultry is IBD. The whole world is now disturbed because of a RNA virus. We are going to disturb another RNA virus. And this is actually this virus is more dangerous because COVID virus have capsule, even simple soap, detergent can kill the virus. But our virus is RNA virus and is a naked virus. It's very difficult to control the virus. This is IB. Disease name is Infectious Bursal Disease or IBD or Gumboro. So let us start with the disease, with the presentation now. Before actually starting the disease, we wanted to discuss something else. Feeding the growing population. We all scientists, agriculturists, or veterinarians, we have the duty to feed the growing population. During 2011, world population was 7 billion. In 2050, it is going to be 9 billion. So 2 billion people growth in 39 years. In order to feed this world growing population, farmer must produce more food in the next 50 years than they have done it during past 10,000 years combinedly. 10,000 years combinedly what they have produced, they need to produce more than that in next 50 years to feed the growing world population. All while arable land is becoming less available. This is the situation we are here. See, we have to increase the production by improving productivity and minimizing loss. Because to feed the growing population, we need to improve our productivity. And at the same time, we have to minimize our loss. In the world, as on date, 1/5 of livestock production are lost due to disease. 20% of productivity, either by mortality or by low production efficiency. We lose 20%, is 1/5. So, improving productivity is another chapter. Minimizing loss of this 20% is very important to us just to feed the growing population. See, if we have 7.78 billion population, we are losing 20% of livestock production, this meat, egg, and all these things. If we can, 20% we minimize the loss, so everyone we can get their protein-rich food. Everyone in the world can get. We the veterinarians have the duty to minimize the loss, this loss. Now come to the disease, the Gumboro is a disease. The name of the disease is a silent killer. People don't understand, don't know, even veterinarians. Even me, after working 36 years, we overlook the situation. Gumboro is a silent killer. The most important highly contagious viral disease in the poultry feeding. The top 4 diseases causing poultry losses, all are viral origin, and fortunately or unfortunately, all are RNA virus. First one is HPI, second is bronchitis IB, this coronavirus. Now coronavirus is doing all the havoc in the globe. Then the low pathogenic avian influenza, that also arenavirus. Next is IBD is fourth, this naked arenavirus. All are arenavirus, top four diseases that causes loss in poultry. All are viral, all are arenavirus. Clinical form of disease is common, but subclinical form is doing the maintenance global. The disease is a major problem in concentrated poultry production areas throughout the world. It is often not recognized due to subclinical form of nature. Affected chicken have increased vaccine failure, strong post-vaccinal reactions, increased incidence of secondary infections. Field veterinarian just read out this paragraph. This disease is not recognized because of the subclinical form. Subclinical form, affected chickens have increased vaccine failure, strong post-vaccinal reactions, and increased incidence of secondary infections. These field veterinarian we are facing every day, and in most of the farm. This global IBD patients, if we see, nowhere is free, only this area, some area is free of disease, otherwise all parts. The most poultry producing area, US, Brazil, India, China, everyone is suffering from IBD. And the Southeast Asian all countries, the poultry producing area, all are suffering from high incidence of IBD or Gumboro. Some chronological events, how IBD came, and today where we are. 1960, first classical IBD outbreak. Around 1966, first licensed mild life strain of vaccine. 1970, incidence and spread of VVIBD in West Africa. In 1984, severe immunosuppression, suppressive cases in USA caused by IBD variant. During 1988, spread of VVIBD in Europe and Middle East. In 1990 only, spread of VVIBD in Israel, South Africa, India, Thailand, this area. India, in fact, 1987 IBD came in layer. That was not that much VVIBD. 1987 IBD came, I've seen in our early career life, and VVIBD in 1990, India, Thailand, North area. 1984, OIE designated IBD vaccine as important socioeconomic disease. IBD virus as socioeconomic disease, OIE designated. Then, in 2017 only, 7 major genotypes identified. 7 major genotypes of IBD virus. And in 2020, as on date, almost all high poultry producing countries are suffering from IBD. Almost all high poultry producing countries. IBD is characterized by destruction of lymphocytes in the bursa fabricius and other lymphoid organs. Virus is resistant to many disinfectants and environmental factors, remain infectious up to 122 days in poultry house environment. Dangerous virus. Poultry house environment, normal poultry house environment, it remains infective up to 122 days. Because of the resistant nature of the virus, once a poultry farm becomes contaminated, IBD tends to recur in subsequent forms. We used to speak, the son receives as IBD as ancestral property. The farm it continues, IBD continues. This is a classical IBD live birds with vein soiling with white stool. This is a 15-day bird spore growth, 15 or 14 day. The birds are suffering from subclinical IBD, as I have seen. I'll show you. I visited the farm, poor growth. Every flock at the farm was poor performance, every flock. Let's go ahead. If the virus damages the bursa in young chicken, the bursa will not producing sufficient number of lymphocytes, B lymphocytes necessary for immunity. Thus, the birds will experience reduced immune system capabilities, means immunosuppression. Earlier, the damage of the bursa occurs, the fewer lymphocytes with antibody producing capacity will be produced. Therefore, any IBD control program should be added to protect the bursa as long as possible. This is all about IBD. IBD damages the bursa fabrices, where B cells are being produced, immunity is being produced, the primary immune organ. If IBD damages the bursa in young bird, so minimum, the bursa will not produce antibody from that period. As long as we can protect the bursa, so antibody will be produced. So our target will be IBD control program should be added to protect the bursa as long as possible. In practical, if bursa can be protected until at least 3 weeks of age, an adequate number of lymphocytes should be produced and immunosuppressive effects of an IBD outbreak should be minimal. This is the payoff line. We need to protect the bursa at least 3 weeks of age. Then immunosuppressive effects will be minimal. We can do our work permit comfortably. That's all about the objective. Now, pathogenicity of Gumboro virus. Gumboro virus shedding is through feces. Then again injection through mouth. This horizontal transmission through feces. Birds are picking that litter and air there. Injection through mouth. Initial replication of the virus in the GALT and the gut-associated lymphoid tissue. Then via bloodstream it reaches bursa. From bursa it spreads to other lymphoid organ and tissues like thymus and spleen. This is the pathogenesis of IBD virus, how it spreads inside the body. Clinical form usually occurs after 3 weeks of age, 3 to 6 weeks in broiler, after 3 weeks. The clinical disease is sudden onset. Mortality rate in the flock increases rapidly. Clinical signs include dehydration, trembling, ruffled feather, vein pecking, depression, white stool with mucus, with vein pasting, white faces. The picture I showed you in the last slide, this one is this is pathognomic to IBD signs, vein pasting with white faces. Affected chicken experience a transient immunosuppression. Dehydration, trembling, because mucosal intestinal epithelial damage is the early sign. So dehydration, trembling, ruffled feather, vein pecking, depression, white stool, these are the signs. Clinical form usually occurs between 3 to 6 weeks of age. Clinical disease has sudden onset in symptom. Mortality rate in the flock increases rapidly. Clinical sign includes all the things. I am repeating the message, but the pictures are different. This is, see the clinical IBD, what are the stool type and what are the bird condition. These are the photographs taken by me during my professional career last 20 years. This is clinical IBD birds. Now the post-mortem lesion of clinical IBD. Bursa picture I have shown you. Initially the bursa is swollen and edematous. This is initial stage. With and has a gelatinous yellowish secretion covering the serosal surface. This is initial stage of the bursa. Hemorrhages and areas of necrosis may be present in bursa in more severe cases. These are the more severe case bursa. You see two bursa, this is almost normal, and this is IBD affected, clinical IBD affected bursa, hemorrhages and necrosis on the serosal surface of the bursa. Necrosis or damage of the primary lymphoid organ like bursa and thymus. Necrosis and damage of primary lymphoid. See the necrosis of thymus. This adult part, what is the size of thymus, and what is the hemorrhage, how much hemorrhagic it is. See the bursa. What is the serosal surface of bursa? These are 5 bursa of the same flock, 5 dead birds from 5 dead birds. Hemorrhage is white gelatinous material, hemorrhages, size are different. This is all clinical IBD postmortem lesions, necrosis and damage of lymphoid organs, hemorrhages in the thigh and breast muscle. Because IBD virus interferes with the normal blood clotting mechanism. Kidney are swollen in dead birds. See the kidney swollen and coming out, dehydrated kidney. See the spleen is enlarged. See the breast muscle. It's clinical IBD. Now the subclinical IBD. The subclinical form of the disease occurs before 3 weeks of age, where chickens show no clinical signs but experience severe and permanent immunosuppression. Majority of field infections are subclinical, and this form is more economically important. Post-mortem examination shows damage and regains bursa due to immunosuppression. No clinical sign outside, but there will be slow mortality. If you cut open the birds, you will see bursa, different size internally. This is 11th age, before IBD vaccination. This is 9th age. See the bursa size, internal situation, hemorrhages, everything. Outside, no clinical signs of IBD. 9th day birds. This is 4 and 6, 10 mortality was there in a big farm. Cut open all the birds in postmortem. Here it is 4, 8. These are all old photo. This same subclinical, I wanted to show you some more. This is 18th day. Before, all these are before vaccination. See the condition of bursa. In which condition bursa size are different, internally gelatinous secretion and hemorrhages. This is 18th day bird. Immediately after vaccination. See, there are 7 bursa. What are the situation? That's your 18th day. This is thymus. And these are bursa. How? See the bursa size. What is the difference in size? What is the color inside the serosal surface? This is how much hemorrhage there. Hemorrhage and necrosis is there in all 4. Here the size, the regressed bursa. This bursa is enlarged. These are regressed. This bursa is normal size because 18th day. Now, integrator commonly have farms identified as problem farm. Broiler from those farms have poor body weight, high FCR, high mortality due to some infection, excessive vaccine reactions. Every integrator have sub farms. The integrator staff, they used to say that farm is a problem farm. Every flock there is some infection, mortality is more, body weight is less. In most cases, investigations have shown that these farms are heavily contaminated with IBD virus. The poor performance is due to immunosuppression caused by subclinical IBD, which I was speaking. I was speaking in the first session. Every flock E. coli, you take the IBD. Every flock there are some infection, some some infection is coming and performance is down. There must be some immunosuppressive infection and mostly IBD. This is these birds. This is not much winter is there. This was not winter. All the birds are dull, depressed, and ruffled feather. They are in sun because they are suffering from IBD. Diagnosis of IBD. Diagnosis of IBD involves farm history, log record, clinical signs, and postmortem results. This, if you go through seriously, it will confirm IBD. Obviously, chicken greater than 3 weeks of age, so no clinical signs. Greater than 3 weeks of age will show signs. Below 3 weeks, no signs. Diagnosis of IBD by postmortem lesion is more practical. During later stage of disease, it is difficult to diagnose IBD by examining only sunken atrophied bursa, as I have shown you, as other diseases like MD, Marek's disease, and mycotoxins produce similar changes. Confirmation of diagnosis should be done by laboratory test like ELISA. Treatment, there is no proven treatment like other viral infections. Antiviral drugs like Virconis, even at the rate of 2 grams per liter through drinking water, helps reducing mortality if you start treatment very early. Electrolytes help regain vitality by minimizing dehydration. Vitamin E, selenium, or immunostimulant like beta-glucan helps immunity development. Antiviral spray inside regularly helps controlling horizontal spread of the disease. This is only, but there is no treatment. If there is clinical IBD, there will be huge loss. Nothing, you can do nothing. Now let us think about prevention and control of Gumboro or IBD. Any successful IBD control program must include these three: effective breeder vaccination program, effective biosecurity program, effective broiler vaccination program. Any IBD virus control program should attempt to protect bursa as long as possible. In practical, if the bursa can be protected until 3 weeks of age, adequate lymphocytes should be produced, and the immunosuppressive effect of IBD outbreak should be minimal. Factors influencing control strategy. There are some factors which are playing havoc. We are unable to control IBD. It's drinking water vaccination and its drawback. We are using vaccines through drinking water. Or drinking water quality, only God knows. pH, hardness, or TDS, whether it contains heavy metals or not, nobody knows. Then, the temperature of the water, when you are giving vaccines to drinking water, everyone knows 100% birds are not drinking water. Within 10 minutes, within 15 minutes, all the birds are not consuming water. So there are some birds are remaining. They are the potent risk factor for the entry of virus. So drinking water vaccination is like no vaccination. To me, I don't believe in drinking water vaccination. In broiler, vaccination means eye drop only. Eye drop only, no option. Or spray vaccination at hatchery or first day in brooding in small space. If you have some efficient sprayer, then spray vaccination. Or injectable, whatever injection, the subcutaneous injection, today's immunocomplex vaccination. Second is vaccine strain selection and vaccination schedule. What are the strain available in your area, in my area? What strain are available? And what is the disease history of the area? So what should be the vaccination schedule? Here, what vaccination schedule most part of India and Nepal are doing? The vaccination schedule made in 1998. I can remember. During 1998, that vaccination schedule formulated, and that is still being practiced. Do you think viruses are in the same status? Because all the living beings, all animals, all bacteria, all virus, common enemy is human being. Everyone want to protect themselves from human being. So they are changing their character by mutation, by antigenic changes. They are changing their character every day. But we are, in case of IVD vaccination, last 22 years, we are sitting on the same chair, and we want efficacy. We want to control IVD. We are daydreaming only. We need to consider the available local strain. We need to consider the history of the disease history of the area, at what age, what type of virus is coming. Then downtime or gap between the crops. We need to give 15 days downtime to minimize the infection in the empty set, because most of the virus needs host body to live. So 15 days downtime, most of the virus, not the IVD virus, other virus dies within 15 days. Another, poultry house cleaning and disinfection, day to day and during downtime. How we are making the shed disease free depends. Only vaccination does not work. The disinfection biosecurity process, and last, the vaccine delivery system and vaccination uniformity. We are delivering vaccines in water or through the enterocooler, whether everyone is getting the same dose. Uniformity, the proper size, is it practical, is it authentic, this much ml of this 0.1 ml or 0.15 ml, this 1 ml of vaccinated water is required, diluted diluent is required. We are not considering these all 5 factors. Because of these factors, IBD is playing havoc and we are doing nothing. We are failing in most of the cases. IBD control program, let us see the virus. This virus remains infectious in the poultry house environment for 122 days, which I already spoken. It remains infectious in feed, water, and poultry house droppings, poultry manure, for 52 days. In poultry manure, poultry stool, in feed, in water, 52 days it remains infectious. Heavy viral shedding from infected birds. Infected birds shed heavy virus. Virus remains stable at pH 2 to 12. What a horrible situation. This virus remains infectious, stable at pH 2 and at pH 12. Just think about the notorious capacity of the virus. Then, this virus can only be destroyed by boiling for 30 minutes at 70 degrees Celsius. 30 minutes boiling at 70 degrees Celsius, virus can be destroyed. Disinfection takes long contact time to kill the virus. Any disinfectant takes long contact time. So in the open area, we are spraying disinfectant. We are not giving the necessary contact time. The disinfectant is not working. We have to allow the disinfectant to work long contact time for the virus, because the virus is a naked one. This is the virus structure. So IBD control program, first we have to do all in all out system. Otherwise, virus will remain in the. Vaccination of breeder is most important. Antibodies produced by the hen are passed through the egg to the chick. This ABV, maternal antibody, if present at adequate level, protect the chicks against early subclinical IBD. This early subclinical IBD, which the picture I have shown you, 9th day, 10th day, 11th day, 12th day, that can be prevented if the MAB titer is at the protective level high. But when in our scenario, those who have breeder, he don't have broiler. So he is taking care of breeder only. He is not taking care of progeny. So he is not doing midway vaccination of IBD kill vaccination around 39, 40 weeks, so that the progeny gets the MAB titer protective level. So he is taking care of the breeder only. He is not taking for the broiler chicks. And the broiler chicks, he don't have the breeder. In case of integration, it is different scenario. They have the breeder, they have the broiler, so they are vaccinating breeder for breeder and for the broilers. Breeder vaccination program shall not only protect the parent or breeder stock, but also contribute sufficient MAB to progeny. That only in case of integration it is possible. Those who are selling, hatching eggs or chicks, they will not do. Why unnecessarily they will? Some money is involvement is there. Why unnecessarily they will do? And that is the major reason of immunosuppression. Third is poultry traffic control. So I discussed during biosecurity, poultry traffic control. Don't take your bike inside. Go inside by following the standard operating procedure of biosecurity. This spray and food bath, all these things. Downtime means set gap between flocks. This culling harvesting time and next 6 housing time. And cleaning and disinfection to minimize the remaining infections in the flock. It is required. See the whitewash of mud floor. How beautiful it looks like. And this is small farm, this is a big farm. How clean outside and inside is. It requires to get rid of the, because IBD virus remains out in this area, it can remain up to 122 days. So if you are cleaning only inside, not outside, so this virus from outside, it will go inside through your feet, through poultry, the labor, supervisor, the doctor, it will go from this area and enters inside. You have to clean inside and outside both. See, these are cleaning picture of breeding farm, how they are cleaning and disinfecting, cleaning and whitewashing the shed during gap period. Important aspect of IBD control program depends on comprehensive biosecurity program, mainly include disposal of dead birds. Disposal of dead birds is very important. Small farm, death pit, bigger, heavy mortality. This type of coop, you have to make it and burial like this. This is heavy mortality. Regulation and implementation of restriction on sale of sick birds. What we do, what developed country like Europe, US do, any farm infection, they used to cull the whole flock, not selling those meat in the market. But what we do, any infection, sell rest of the birds, sell the live birds to the sale. So we are spreading the infection through the vehicle. The vehicle moves, whatever the road vehicle moves, it is spreading the infection. And that vehicle next day, they will not disinfect them properly. Next day, they will go to some other farm. They will freely give the virus to those farms. So regulation has to be made by the government and implementation of those regulations about restriction of sale of sick birds. Not dead birds, it is sick birds. Next is disinfection of contaminated premises by good disinfectant before housing chicks and in presence of birds. This is before housing chicks. This is in presence of bird outside and inside. Regular disinfection. Suppose today just virus entered. The virus dose only minimum virus entered. If you are disinfecting regularly, you can kill those virus before producing the disease. That's why regular disinfection inside outside. As we are producing virus in the most virus full area. Our area is full of virus. Number 8 point is scientific vaccination program. All these biosecurity, set cleaning, norms, now the biosecurity is the vaccination. Things to consider to schedule vaccination program. History of IBD incidents in the area. This is very important. History of IBD incidents. Regularly coming or sometime came or not at all coming. And at what age IBD is coming, at what age of the how many farms are infected in those areas? This whole record. Then bird type, is it a boiler, layer, or breeder? The maternal antibody titer of the chicks, MAB of the chicks. Must be 3,000 plus. Virus strain available in the area. Regular sending sample to the laboratory available in the area. What are the strain available in the area? Disease history, vaccine strain, MAB of the chicks, and what type of birds involved. Now you plan the vaccines program. Criteria for ideal vaccine. In the world, nothing is ideal, but we want what do we want as a field veterinarian, as a farmer. What do we want for the criteria of ideal vaccine? Early protection in presence of MAB. In presence of MAB, it will give protection. Stimulates active immunity in presence of MAB. Safe for chicks with low level of MAB. Sorry. Safe for chicks with low level of MAB. Broadly antigenic stimulation of antibodies, broadly antigenic. Convenient and easy administration. Uniform delivery to every chicks. Single administration to provide full protection with long-lasting immunity and cost effective. What we expect is ideal 100%. If any vaccine have this much quality, so there will be no IBD in the world. All this cannot be, is not possible, but what more permanent, how much of these criteria are available with the available vaccines? How much criteria it satisfies? Especially is to early protection in presence of MAB. Stimulates active immunity in presence of MAB. Safe for chicks with low level of MAB. Because with outsourcing chicks, we don't know MAB. In all the cases, MAB checking is not possible. So this criteria we are expecting from the vaccines. Let us see. Vaccination program in our boiler. Now, let's think what vaccination program can we do. Conventional 12-day vaccination with strain as referred by Poultry Veterinarian, what we are doing. Do this vaccination on 12th day. Then immune complex or vector vaccine at hatchery or in ovo, or vaccination before chicks housing. Means immune complex or vector vaccine at hatchery or in ovo on 18th day in incubation or before housing as subcutaneous injection. Third option, double IBD vaccination at farm. 7-day intermediate and 14-day intermediate or plus vaccination as advised by Poultry Veterinarian. Especially with low MAB from outsourcing chicks, we have before immune complex vaccination, we are doing this. This is giving success in small farms. 7-day intermediate with 14-day intermediate plus, or maybe intermediate sometimes. There is a guidelines for IBD vaccination. Think your area. What is the challenge level? Is a low challenge level? Then what is the biosecurity level? Low challenge with high biosecurity, single intermediate is enough. Low challenge with low biosecurity, 2 intermediate, 6-7 days gap. Moderate challenge, high biosecurity level. Immunocomplex vaccine at hatchery or 2 intermediate, 6-7 days gap. Immunocomplex only 1 vaccine or 2 intermediate as per your situation in your area. It's moderate challenge but low biosecurity. Then immunocomplex or intermediate plus intermediate plus. 1 intermediate along with 1 intermediate plus, which in most of our area, moderate challenge with low biosecurity. We are doing this or in this immune complex vaccination. Now, if the challenge is high, like in Nepal and Bangladesh, IBD challenge is high. If your biosecurity is high, then immune complex 1 is more than sufficient, or 1 intermediate plus at 12 days. If your biosecurity level is high, but practically in Bangladesh, Nepal, and in our part of India, challenge is high and biosecurity is low. So, immunocomplex vaccine plus intermediate plus 1 on 11-12 days. It's 11-12 day gap. Either intermediate or intermediate plus. It depends on the mortality pattern of the field. It is only immunocomplex is not sufficient. You have to give 1 light vaccine of intermediate or intermediate plus. In Bangladesh and Nepal, most areas like this only. You have to do 1 immune complex vaccine plus 1 intermediate plus or even intermediate only. Otherwise, you can do 1 intermediate on 7th day and intermediate plus on 14th day. This is number 3. This in most areas. This is a standard guideline by many scientists, a group of scientists, guidelines, global guidelines. Remember the fact, who reaches first will sit, stay, and multiply. If it is field virus, then disease will come. If it is vaccine virus, then immunity will come. In IBD, in case of IBD, in Bursa, there is competitive expulsion happening. If the field virus enters, it will sit. If the vaccine virus enters first, it will sit, grow, and proliferate. It will be there. Afterwards, if field virus comes, it will act against the field virus by competitive expulsion also. In case of IBD, there is 3 types of mechanism, immune mechanism. Humoral antibody and cell-mediated antibody and competitive expulsion from the Bursa. These 3 things happening when IBD vaccination is given and afterwards virus has entered. So this is about IBD vaccination program. Hopefully things are clear to all of you. This is IBD vaccination program of layer breeder. In case of layer, first vaccine intermediate on 14th day and on 26th day give an intermediate plus through drinking water but controlling everything. It is better to use RO water that time. And in case of broiler breeder, on 16th day, IBD intermediate, 26 to 28 day, like layer, it is an intermediate plus. Then around 19th, 20th week, IBD kill. And around 39-40 week, IBD kill. This IBD kill is meant for progeny. This is not for the breeder. The breeder will be immune. There will be very high antibody titer. That antibody will be passed to broiler so that the broiler will protect himself in the early part of life against subclinical IBD infection. Same, remember the fact, who reaches Bursa first will sit, stay, and multiply. If it is vaccine virus, then immunity will produce. If it is field virus, disease will produce. Now, why so many sporadic outbreak of IBD. We are using vaccines. Why there are sporadic outbreak of vaccines? Because most of our breeder layer farm are multi-age. Our husbandry practice, we are this poultry traffic. There is no control on poultry traffic. We are transferring equipment from one set to another, one block to another. Then our habit of drinking water vaccination and the maternal antibody level. All these are the reasons of sporadic outbreak of IBD in layer, breeder, and broiler. These are the 4 reasons of sporadic IBD outbreak. While doing vaccination, we want safe and more effective vaccination. This is in one part. Suppose this is a scale. In one side, only safe, effective vaccine. And what on the other side? There is a pressure of using less antibiotic. The modern poultry farming favors spread of disease because of integration. Contract farming supervisors visiting many farms is spreading disease. Labor is an issue everywhere in the world. Welfare, birds welfare, they need more space. All these are on the one side of the scale. On the other side, only the effective vaccine. Vaccine is unable to do its job. Best vaccine and best method of vaccination alone not sufficient to prevent IBD. Vaccination together with best biosecurity helps control Gumboro disease. Best vaccination process, technique, and schedule, along with best biosecurity, only can control Gumboro or IBD. Best biosecurity, this cleaning, disinfection, traffic control, mortality disposal practice must be continuous, not in one flock. IBD was there. Sir, my farm was suffering from IBD. I am doing cleaning all these things in one flock. No, it should be continuous, at least for 3 to 4 flocks, because improvement is gradual only, often only seen after 3 to 4 flocks. Best biosecurity, best vaccination, consecutive 3-4 flocks, then only IBD can be controlled from any farm. Otherwise, you will be suffering regularly IBD problem. Thank you. Thank you all about IBD.
Okay, thank you, sir, for your nice presentation on the most common disease existing in the boiler industry, that is infectious bursal disease. Now we will entertain a few questions from participants' side if there are.
Is there any question? Can you use probiotic and water sanitizer at the same time? Probiotic along with acidifier is excellent. Sanitizer better, and that 1-2 hours water better not to use sanitizer. Probiotic works better in acidic pH, so acidifier should be used along with probiotic. In which age peak case of IBD is seen? What are the common secondary infections that follow the disease? IBD, clinical IBD, usually 22 day onward. Clinical IBD in broiler. In layer, anytime after 24th week. Layer breeder. And subclinical IBD, I have seen from 8th day onward. So it's not from textbook. I showed you the picture. Subclinical IBD on 8th day. First sign of IBD, if you sacrifice or cut open a 7-10 bursa, the 7 bursa size will be different. On the same flock of birds, but the bursa size, you will see the size will be different. Then you cut open the bursa, internal contents, internal color will be different. That is the early sign of bursa IBD. Then the other signs, other clinical symptoms and lessons in the history. What are the common secondary infection? Common secondary infection, E. coli is waiting, Mycoplasma is waiting, and the farm for IBD infection. They are the most common. And during this season, ND virus is very effective. ND, low pathogenic avian influenza, it can come after IBD. Even after IBD, necrotic enteritis, coccidiosis, because necrotic enteritis they are commensal of large intestine, so they may come to small intestine favorable situation. And coccidiosis, when the immunity is down, coccidiosis can happen. So all these infection after IBD may happen. Vaccination in broiler, which route is the best? In broiler, IDOP is the best, or hatchery vaccination as injection. Any question, please?
Doctor, I have a question. If after vaccination, if outbreak of Gumboro held at the farm, then what should the farmer do at that time?
After vaccination.
Yes, if some failure happened at the
Now,
farm,
how
then
many days after vaccination usually?
uh, sir, I had seen in broiler when on 12th day they do the IBD, and after on 20th day we can see the again the outbreak of the Gumboro. Then what should the farmer do at that time?
For IBD vaccines outbreak, you can do nothing. You can use antiviral drugs. If your ND vaccination is completed, then it is okay. If not
Okay,
completed, immediately you do a booster ND vaccination on 20th day. If you have done vaccination on 19th day, it is okay. Otherwise, 20th day, first do the ND vaccination. Control ND
okay,
first.
sir.
And IBD, you need to change the vaccination schedule. One IBD
Okay,
vaccinations on 12th day is not sufficient. You have to check the MAB. If possible, use immune complex, because in the throughout the world, now 60% broiler are being vaccinated in the hatchery only through immune complex vaccination. Whole world, 60% broiler in hatchery vaccination. We are in 40%. In India also, around 15% broiler are doing hatchery vaccination, more than 15. Now it will be around 20.
okay, sir. And one more question, Dr. Saab, if we are doing the spray of disinfectant
Yeah.
inside the farm, how we should do that in we vertically or on the bird we can,
No, not
because
directly to
if
the bird. I have shown the
okay
spray. It is on the top, like
vertically
vertically on the top, so that it should
okay
come down in like fog to the feeder, to the bird, to the eater, everywhere. Not directly, never directly. These
okay
disinfectants are very much, they are very much irritating to the respiratory tract.
okay
That should not directly enter to the.
because some farmer told that na, there is no harmful effect on the birds, that's
Now
why I'm asking for that. Okay,
you
how
are aggravating respiratory problem. You are creating respiratory problem. If you
okay
are giving directly to the birds, they are very much toxic, very much irritant to the respiratory tract. Even during spray, the
okay
farmer should close his nose and mouth to
How
nothing
reg-
else than towel only, hand towel or any towel.
okay okay
every day we have
thank
to
you,
go
doctor.
for every day or every alternate day?
No, it depends. See, if there is this healthy climate like October, November, you can spray internally once in a week
Okay.
and outside twice a week.
Okay.
But the disease season, if there is no infection in your area, twice a week is sufficient. If infection already existing in your area, in nearby farm infection is there, use it alternative day. It depends.
Okay.
And inside use is Vircon is only WHO approved product. It is not toxic. It can be used through drinking water. You can use safely Vircon. Even in case of a human being, our poultry offices, boys are working. They are disinfecting their bedroom, sometimes with Vircon, because they have Vircon stock in the branch. They are spraying Vircon for 1 hour. They are locking the room, then opening. They are making it virus free because they are also staying. They are handling bird flu cases. So they are doing like that. We educate them like this. Be safe. Any question more?
So what about use of paracetamol in IBD control? There, I have found some are using paracetamol.
If there is
to reduce
paracute or acute infection, any acute infection, if there is hyperthermia, then you can use paracetamol. But paracetamol make further depression. It is tranquilizing effect, sedative effect. Birds will sit down. It will not take food. Only in case of huge emergency, highly pathogenic virus and birds are while touching the birds, there is huge hyperthermia. You can use once or twice.
Okay.
Just to reduce the body temperature, because thermal shock may happen with the viral shock. Thermal shock also happen in the bird's case also, like human being.
Okay. There are a few questions in chat box.
In case, in which age peak case of IBD in vaccine route? What's about the use of paracetamol? In breeder, we are using ND plus IBD kill. Vaccine on 21 days. Kill 21 days. Is it okay? Or ND IBD kill on 21 days, it is okay. I could have shown on, I can share you the vaccination schedule of breeder. There is a, that is in some, what is doing on 20, you can prepone it. It is better to use it on 17, 18 days. This IBD in breeder, ND IBD kill, you can prepone 2-3 days, or otherwise it is almost okay. You can prepone it is on 17, 18 days. How to know that there is vaccination failure? Is there any specific PM lesion? Only by checking the titer only. For ND after 3 days, for IBD after 6 days, you check the titer. You can get know the vaccination is okay or not.
Okay, I think there are no more questions. Is there any question? We'll take few. Otherwise, we will move to the next presentation.
Let us move to, because that is a big presentation. That is avian influenza, the notorious thing.
Yeah. Okay, Dr. Datta, you can start your presentation on low pathogenic
I have to
avian
share the
influenza.
screen.